The next topic we're going to be looking at is the characteristics of depression. Depression is a mental disorder which is characterised by low mood, energy and energy levels. What you need to know from the spec just needs you to know the behavioural, emotional and cognitive characteristics of depression. Unfortunately, about 2 in 3 adults will have depression at some time in their life. That's pretty much most of us. It's 2/3 of us will have depression. 1 in 4 women and 1 in 10 men will require some treatment for it at some point. The average length is about 4 to 6 months. And also, really sadly, about 4% of children do suffer from anxiety and depression. So, our DSM-5 categorises your major depressive disorders, which is severe, but often short-term. Your persistent depressive disorders, which are long-term or reoccurring, so they just keep going. You feel better, it comes back. You feel better, it comes back. The disruptive mood dysregulation disorder this is a childhood temper tantrums. A lot of children will obviously go through this, but it's just a bit more extreme in terms of these childhood temper tantrums. And lastly, a premenstrual dysphoric disorder, which is PMS basically, so that time when we feel quite grumpy before or around our period. It's not on here, but also postnatal depression. That would be considered as a major depressive disorder. And you can see on this side of the screen just listed some of the symptoms that we're now going to be looking at in more detail. So the behavioural characteristics. Firstly, activity levels. People with depression have reduced activity levels. They feel what we call lethargic. They can withdraw from work because they feel so tired. They social activities, and they may, stop going out altogether. On the opposite hand, they can also have something called psychomotor agitation, where they cannot stop. They are pacing the room. They feel really distressed. The next behavioural characteristic is disruption to sleep or eating behaviour. People can suffer from insomnia, so the ability to get to sleep, or persistent waking when you manage to get yourself to sleep, so you're easily woken. Or hyperinsomnia, where you just cannot stop sleeping, you feel consistently tired all of the time. Quite often when people are depressed, they can either overeat or undereat to make themselves feel better. And lastly in this category, aggression and self-harm. People who are depressed can show signs of being very irritable or very aggressive towards others. But they can also direct this aggression on themselves, so by self-harming, via cutting, or other means of actually hurting themselves. And in the extreme case, committing suicide or attempting to commit suicide. So the emotional characteristics. We often think of depression as someone with a low mood, but we can all have or feel down or feel a bit sad. What we're talking about when people have clinical depression is they are extremely sad. I mean, sad just when there's nothing to be sad about. They feel worthless. They can feel empty. So it's very different to just having a sad day or feeling a bit unhappy about something. Again, anger is an emotion which we put in this section as well. It's sort of aggression. So the aggression is the behaviour. That's in the behavioural section. That's actually acting out the anger that you may feel. Not everybody acts out the anger they may feel. It can, again, the action is leading to self-harm. A lowered self-esteem. Self-esteem is a measure of how much we like ourselves. And pretty much everyone with depression can often say they don't really like themselves very much. They don't like the way they look, the way they act around people. They think they're basically not very clever. They just don't like themselves. Self-loathing, you could call that. So your cognitive characteristics, don't forget, this is the way that people think. It's what's going through their head. I think sometimes you guys find this a bit difficult to get. It's what people think. Because quite often they've got lots of racing thoughts, or they can't think straight, they can often suffer from poor concentration, can't stick to tasks, don't really know what they're doing, can't make decisions. Again, this can make going to work very difficult, or interacting with friends and family. They will also focus on the dwelling and negative thoughts. They will have overgeneralizations. They will think that it's the end of the world. I suppose that's absolutist thinking, by the way. But they would just have very negative beliefs about things. So totally irrational beliefs about situations. They'll only think about the negative aspects of things that have gone on in their life. And that is their focus. Also, there's absolutist thinking. It's very black and white. It is the end of the world to them. You know, everything's a disaster. One thing goes wrong, and the whole thing is a disaster. It's just not the thing. Everything else, you know, if you were having a party and you burnt your chips, then they would decide that, oh, the party's horrible, the party doesn't work. Oh, well, actually, it was just the fact that the chips burnt. So it's very black and white thinking. It's either one way or the other. So that's it for characteristics of depression. Don't forget to check out the how to answer questions on characteristics of depression video that I will upload soon. Bye.